If you're over 60, this sweet and juicy habit could silently increase your risk of a stroke overnight with no warning, no symptoms, and no pain. You go to bed feeling fine, and by morning, your speech is slurred, your balance is gone, or one side of your body simply won't move. As a neurologist, I've seen far too many seniors suffer strokes they never saw coming. Not from smoking, not from fast food, and not from lack of exercise, but from something they believed was healthy: fruit. Yes, fruit. Every day, millions of seniors eat fruit thinking it's good for their heart, brain, and digestion. And while many fruits support healthy aging, some, especially when eaten at the wrong time or in the wrong amounts, can cause silent damage. They spike your blood sugar, dehydrate your brain, or dangerously interact with medications. And the scariest part, no one ever warns you. Hello, I'm Dr. Grace Prescott, a neurologist. And today I'm going to show you 9 common fruits that could be increasing your risk of stroke, memory loss, or even brain bleeds, especially if you're over 60. Have you ever wondered if your healthy habits might be harming you? If so, you need to hear this, and I promise it could save your life. Before we start, if you haven't subscribed yet, I recommend hitting that button and turning on the notification bell so you never miss another health tip made just for you. If you like the video, type 1 in the comments. If you don't, type 0 to help me improve the content. As a neurologist, I've seen many unexpected strokes, but few things disturb me more than seemingly innocent habits that silently lead to disaster. And bananas, believe it or not, are one of those hidden dangers. You've probably heard your whole life that bananas are the perfect snack. They're soft, easy to digest, rich in potassium, and even labeled heart healthy. For adults in their 30s or 40s, that may be true. But after 60, everything changes, especially how your kidneys, blood vessels, and heart handle sudden shifts in minerals like potassium. Let me explain clearly. With age, our kidneys naturally slow down. They don't filter as efficiently, especially if you already have high blood pressure, diabetes, or take common medications like acid reducers or diuretics. This means potassium, which bananas have in abundance, can start to build up in your bloodstream. What happens then? Your heart starts to falter, your blood vessels constrict, and worst of all, clots form in areas where blood should flow freely. In the brain, this kind of clot can shut everything down in seconds. I'll never forget a patient of mine, Mr. Raymond Carter, 66, a retired carpenter. He was active, sharp-minded, and proud of eating healthy. Every morning, he'd slice a banana over his oatmeal and take his blood pressure medication with orange juice. It was a routine he'd followed for over a year. But one morning, his wife found him collapsed in the bathroom. He couldn't move the left side of his body. His speech was slurred. At the hospital, tests revealed a small but devastating stroke. His blood potassium levels were dangerously high, interfering with his heart rhythm and causing clots overnight. He had no idea that 2 bananas a day, combined with his medication, were pushing his body into dangerous territory. Here's the part most seniors never hear. You don't need that much potassium all at once. A large banana can have over 450 milligrams of potassium. That's enough to throw your body off balance if your kidneys aren't functioning at full capacity. If you eat that banana at night, when circulation slows and hydration drops, it creates a perfect storm. So, what should you do if you're over 60, especially if you take heart or blood pressure medications? Limit yourself to half a banana a day, eaten in the morning, always paired with protein like Greek yogurt or nuts to slow absorption. Avoid banana smoothies, banana bread, and especially don't eat them before bed. And most importantly, talk to your doctor about how potassium-rich foods interact with your medications. This is a recommendation I, Dr. Grace Prescott, cannot stress enough. Your life may depend on it. Grapes, sweet, juicy, refreshing. A snack that seems so innocent. But what if I told you that for someone over 60, especially those with hidden vascular issues or unstable blood sugar, grapes can be a silent trigger for a stroke? It's easy to forget that grapes are concentrated sugar. Eating just a handful can send a surge of glucose straight into your bloodstream. And for aging brains and blood vessels, that spike comes at a high cost. With age, our bodies become less efficient at managing blood sugar. When sugar rises quickly, it causes inflammation in the delicate walls of arteries, including those that supply the brain. Over time, the lining of those vessels can develop tiny tears, and that's where clots start to form. Let me tell you about Mrs. Janet Miller, an 80-year-old retired teacher. Her favorite snack was a generous bowl of red grapes. One day, she noticed her vision blurring. Moments later, her hand was trembling. At the hospital, she was diagnosed with a transient ischemic attack, a mini stroke. Her tests showed sharp blood sugar spikes and chronic inflammation in her vascular system, likely worsened by years of eating very sweet fruits without balancing them with protein or fiber. Here's what I want you to understand. Even healthy foods can become dangerous without the right context. So now I tell my senior patients, never eat grapes on an empty stomach. Pair them with protein, like a few almonds or a slice of cheese, and limit portions to a small handful. For many seniors, mangoes are a tropical treat, a reward for doing something right. They're soft, fragrant, and naturally sweet. But for seniors, especially those managing heart issues, blood pressure, or multiple medications, mangoes can be a silent saboteur, increasing stroke risk in ways few doctors mention. The uncomfortable truth is that mangoes are one of the highest sugar fruits. Just 1 cup of ripe mango contains nearly 45 grams of natural sugar, more than a typical donut. For seniors with insulin resistance, type 2 diabetes, or unstable blood pressure, this roller coaster effect can overburden blood vessels, especially those in the brain. When sugar spikes, the body responds with inflammation. Arteries constrict, and in the delicate vessels that supply the brain, this inflammation can cause tiny cracks in the lining, leading to clot formation. The risk doesn't stop at pesticides. Strawberries also contain purines, natural compounds that break down into uric acid in the body. For those with a history of gout, kidney issues, or vascular inflammation, high uric acid can trigger inflammation that narrows vessels, raises blood pressure, and forms clots. One of my patients, Elaine Thompson, 80, always loved strawberries. Over time, she started feeling dizzy in the mornings and had swollen joints. One morning, she woke up with numbness in her right hand and slurred speech. A CT scan confirmed a mild stroke, and her tests showed elevated uric acid, fueled by years of excess purines. Her strawberry habit, meant to protect her, had become a subtle daily dose of risk. Apples, the symbol of American health, right? An apple a day keeps the doctor away. You've heard it your whole life. But for seniors, especially those over 60 dealing with high blood pressure or diabetes, apples may not be so innocent. In fact, the wrong type of apple, eaten the wrong way, can silently increase your stroke risk. Many popular varieties like Fuji and Gala are bred for sweetness. They have a high glycemic index, meaning they flood your blood with sugars faster than your aging system can handle. This sharp rise and fall in sugar impacts your blood pressure and blood viscosity. Over time, this repeated pattern damages the delicate lining of arteries, including those supplying the brain, creating the perfect environment for clots. One of my patients, Sarah Louise Bennett, 81, ate a large Honeycrisp apple every afternoon. What she didn't know was that she was insulin resistant, and those daily sugar spikes were overloading her vessels. One evening, she had a mild stroke. Her tests showed unstable glucose patterns and signs of inflammation. If you love apples, choose lower sugar varieties like Granny Smith and always eat them with a source of protein or fat to reduce the glycemic impact. Now, let's talk about a fruit that's a true wolf in sheep's clothing for many seniors. Grapefruit. Often recommended for weight loss and packed with vitamin C, grapefruit hides a serious danger: its ability to interfere with dozens of common medications. It contains compounds called furanocoumarines, which block a crucial liver enzyme, CYP3A4. Think of this enzyme as your body's cleanup crew, processing and eliminating medications. When you eat grapefruit, it's like that cleanup crew goes on strike. The result? Medications aren't metabolized properly, and their levels in your blood can rise to toxic concentrations. This is especially dangerous for seniors taking statins for cholesterol, calcium channel blockers for high blood pressure, or certain blood thinners. Toxic levels of these drugs can cause everything from severe muscle damage and kidney failure to fatal heart arrhythmias, which in turn can lead to a stroke. I had a patient, Mr. Robert Hayes, 72, who had been on a statin for years. He decided to start drinking grapefruit juice every morning to clean his arteries. Within weeks, he could barely walk due to excruciating muscle pain. Blood tests revealed his statin levels were 10 times higher than normal, putting him at imminent risk of kidney failure. The rule here is simple and non negotiable. If you take prescription medications, especially for heart conditions, ask your doctor or pharmacist explicitly about grapefruit interactions. It's not a risk worth taking. Let's move to pineapple. This tropical fruit is celebrated for its sweetness and an enzyme called bromelain, famous for its anti-inflammatory and digestive properties. Sounds great, right? But that same enzyme can be dangerous for seniors on blood thinners like warfarin or antiplatelet drugs like low-dose aspirin, which millions take to prevent heart attacks and strokes. Bromelain also has a blood-thinning effect. When you combine pineapple with a medication that already does this, the effect is amplified. This can make your blood too thin, drastically increasing the risk of uncontrolled bleeding. A minor fall that would normally cause a bruise could lead to severe internal bleeding. The worst case scenario is a hemorrhagic stroke, where a blood vessel in the brain bursts. One of my patients, Mrs. Susan Carter, 78, took aspirin daily. She loved fresh pineapple and started eating large portions every day. One morning, she had a sudden, intense headache, followed by confusion. At the hospital, we found a small brain bleed. Her clotting time was dangerously prolonged. The silent culprit was the combination of her medication with excess bromelain. For those on blood thinners, pineapple consumption should be very moderate and discussed with a doctor. What about dried fruits, like raisins, prunes, and apricots? They're seen as a healthy snack, high in fiber, and great for gut health. The problem is that the drying process removes water but concentrates everything else, especially sugar. A small handful of raisins has the same sugar content as an entire bunch of grapes. For a senior whose pancreas doesn't respond as efficiently, this is a glucose bomb. The resulting blood sugar spikes cause vascular inflammation, stiffen arteries, and make blood stickier, increasing clot risk. Beyond sugar, many commercial dried fruits contain sulfites as preservatives. For some people, sulfites can trigger inflammatory reactions and oxidative stress, another blow to blood vessel health. I remember Mr. George Wilson, 69, who was pre-diabetic and ate a bag of dried apricots every afternoon, thinking it was a healthy choice. He complained of brain fog and blood pressure spikes. One day, he had a transient ischemic attack, a mini stroke. His A1C test, which measures long-term blood sugar, had skyrocketed. We switched his snack to a handful of nuts and his levels stabilized. The lesson is to treat dried fruits like candy. Consume them in tiny amounts and always with a source of protein or fat to cushion the sugar impact. Finally, let's talk about cherries. They're praised for their antioxidants and natural melatonin, making them popular as a nighttime snack to aid sleep. The paradox is that while melatonin may help, cherries are also very high in sugar. Eating a bowl of cherries before bed, when your body's metabolism naturally slows, can cause a major blood sugar spike overnight. Your body releases insulin to counter it, which can lead to a sharp sugar drop hours later, in the middle of your sleep. This nighttime glucose roller coaster is incredibly stressful for the cardiovascular system. It can cause inflammation, raise blood pressure, and disrupt heart rhythm, all while you're supposed to be in a state of rest and repair. One patient, Mrs. Helen Foster, 75, started eating cherries every night on a friend's recommendation for her arthritis pain. She noticed waking up with a racing heart and mild headaches. One morning, she woke up with numbness on one side of her face. It was a small lacunar stroke, likely triggered by the vascular instability happening night after night. Her intention was good, but the timing and quantity were wrong. If you love cherries, enjoy them during the day in controlled portions. For melatonin benefits at night, it's safer to talk to your doctor about supplements or low-sugar extracts. We've reached the end of our list, and I hope this conversation has been eye-opening. My goal here, as Dr. Grace Prescott, isn't to scare you away from fruit, but to raise awareness about how our bodies change over time. What was beneficial at 30 may need a second look at 60, 70, or 80. The key is balance, moderation, and above all, knowledge. Eating smart means understanding how foods interact with your body and your medications. If you found this content helpful and want to keep getting tips for healthier, safer aging, please give a like, subscribe to the channel, and